How are you?
Good afternoon and welcome to the regular meeting of the Forsyth County Board of Commissioners. We're going to meet regularly today, and we're also, following this meeting, going to have a briefing for the 4th of March. Commissioners, it seems like the time is flying by. I mean, we're being briefed for the 4th of March following this meeting. I will begin our meeting right now with an invocation from Pastor Frank Robinson, Messiah Community Christian Church, followed by the Pledge of Allegiance. Today, led by Commissioner Richard Linville. Please stand if you can. Thank you very much. Apparently the pastor missed it, so we'll pick him up next time around. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Citizens who wish to participate in today's meeting and the public session, and we're going to have that in just a few minutes, will have to give us a call, and we have a telephone number for you, and I'll repeat that as soon as I read it for you. It will be answered by the clerk to the Forsyth County Board of Commissioners, Ashley Sloop, and she will handle it from there. But here's the number if you have any thoughts or opinions about the problems, needs, and interests of Forsyth County. Please call us at this number, 336-422-1200. Telephone number again is 336-422-1200. 336-422-1200. You'll be placed on hold until the public hearing begins, and as I say, that will take place momentarily, but first we have some business to take care of. We're going to start with Joshua Swift, who is the Public Health Director in Forsyth County, for his regular update on COVID-19, commonly known as the virus. Mr. Swift, are you there? I know he is there. I can see his initials. We're now having a warm body from this room go to the next room to check to make sure we're ready. I know that most of you watching us on Channel 13 are wondering what's going on. I can tell you, when we're dealing with remote broadcasts and remote meetings, we don't see each other. So in this particular case, Joshua Swift, I know is there. I just can't see him. He can't see me. And it'd make things even worse. We can't hear each other.
We could just push it to the end of the meeting and go on with the meeting, Mr.
Well,
Chairman.
why don't we do that? Now, there is a solution by the county manager who is who is that on the picture there?
Mr. Chairman, that
Yes?
is Pastor Robinson. He is available.
Oh, my goodness. Well, Pastor Robinson, are you there? Can you hear us? Hello? I don't think he can hear us. There is Joshua Swift. We're going from a preacher to a health director. And I don't think Joshua knows that he's on camera. And if he does, he can't hear us. Maybe we could take up an offering. What do you think about that, Mr. County Manager? We don't have enough people in here to make any money. So
Here's the pastor back.
I saw the pastor move. This is almost like calling a play-by-play. You know, they now have sound from Mars. We can hear the sound.
Hello. Hey, this is Joshua Swift. Can you hear me?
Joshua, yes, sir, we can. Bless your heart. We didn't think you were going to be.
Dr. Reverend Robinson. I'm trying to reach, can anyone else hear the commissioners? I haven't heard anything. From the
Yes, this is Dave Plott. I'm Commissioner. The problem we have right now is I can't see you. There, now I can see you.
I can hear you, Joshua, and I just heard whoever also spoke.
Okay, so now we got Joshua ready to go and the pastor ready to go.
Let's just stand and see who comes in first.
For those who missed it, Commissioner Kaplan, always a man with a solution, said, let's stand and see which one starts first. Pastor Robinson, can you see us? We can see you. Can you hear us? He cannot. Mr.
We're sorry.
Swift,
You must dial a 1 when calling this number.
we're not
Will
calling.
you please...
She came out of nowhere. I frankly think we probably, in a next moment or two, have to go on with our meeting, and we'll come back to this later on. County manager is moving around the room amongst the people. The pastor's lips are moving.
Welcome to the audio conferencing
Oh,
center.
Lord.
Please enter a conference ID followed by pound.
I would suggest if it's okay with the board, about a 5-minute recess. Why don't we get
All
our
right,
ducks in a
gentlemen,
row and then we'll come back.
Commissioner Kaplan has asked that we take a 5-minute recess. I'll second that. We'll take a 5-minute recess. Don't go away.
Sorry, I can't find a mute.
Commissioner Watson has
Richard, you were ready.
Can someone call? He's preaching. Easy. He's praying. We got more to go. Prayer. Can someone call him? Yes, he really think he's.
You know what?
That's the second time.
I'm going, see, it says your microphone is muted. That's us.
Six.
We stand to hear Pastor Frank Robinson of Messiah Community Christian Church with our invocation, and then Commissioner Linville, if you'll make another effort, Pledge of Allegiance, please stand. Pastor Robinson, you may start.
All right. Once again, I greet you on behalf of Messiah Community Christian Church right here in Winston-Salem, and let us just pray. Psalm 32:8 reminds us, it says, I will instruct you and teach you in the way you should go. I will guide you with my eye. Creator and sustainer of all that is or will ever be, we ask that you will accept our thanks for this day. and all of its blessings, its opportunities and challenges. We thank you for life, health, and strength in these uncertain, trying, and even confusing times. We thank you for these leaders that serve the people of this great city. Let them ever be mindful that they serve with honor, and along with that honor comes a duty of humility, integrity, and public service. Forgive us for when we don't thank you enough for who you are, for all that you do and all that you've given. As we are still in the midst of a pandemic, we call upon you for solution and healing for those families that have suffered and lost loved ones. So God, we touch and agree and ask that you will continue to cover this nation from the White House to our house, cover the state of North Carolina, and cover, bless, and prosper this great city, Winston-Salem. As we make every effort to hear your voice in every decision, follow your direction, allow leadership not to lose sight that we are but stewards of your authority. Where there is continued division throughout this nation, city, and even state, we ask that you will instill unity. And where there is hate, we ask that you will overcome it with your love. May we continue in this new year with optimism, renewed energy, and commitment to put you first. This is a plea for your grace to abound us, and this is a petition from our heart for your mercy to surround us. For all of this, we touch and agree, for there is power in agreement. Amen, amen, and amen.
Amen. Thank you, Pastor Robinson. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Commissioners, I was talking with Commissioner Ted Kaplan briefly a moment ago, and by the way, we are out of the 5-minute recess, but Commissioner Kaplan says, well, probably all of this is happening because this is the first time in my memory we have ever met on Tuesday afternoon at 2 o'clock. And because of that, we prayed twice. We've said the Pledge of Allegiance twice. And now we're going to give the telephone number for people who are upset with something, or at least have some thoughts regarding the problems and needs or interests in Forsyth County. So we're going to make that telephone number available one more time. And then, of course, I mentioned that Ashley Sloop, who is the clerk to the Forsyth County Board of Commissioners, will answer the phone, and you'll be placed on hold until the public session begins, which will not be too far away. Telephone number is 336-422-1200. 336-422-1200. If you have anything on your mind, just give us a call. You'll be limited to 3 minutes. Next on the agenda is the man who takes all the heat and gets a lot of the praise for what he's doing regarding COVID-19, the virus that we're all well aware of and have problems with. Joshua Swift, are you ready?
Yes, good afternoon, Commissioners. I hope you can hear me and see me. I'm going to share my presentation.
We can see you beautifully. That's fine.
Okay.
There we go.
Okay. All right. Good afternoon. I'll start with our COVID cases. As of today, we've had a total of 31,305 cases in Forsyth County since we started in March of 2020. But we've had a positive trend where the last 14 days we've only had 1,704 cases. So our average cases per day is 121. I'll note that between Thanksgiving and Christmas, that mid-November through late December, we were averaging well over 250 cases per day. So that's a positive trend. Overall, we have had 338 deaths since the beginning of COVID-19 in the county. Next, this is a chart you've seen many times before. This was for last Thursday's presentation, so it is dated for February 13th. You can see that our breakdown by gender, 53% of our cases have been female, 47% are male. You can see the breakdown by age, still trending. A lot of our cases are in younger individuals, 45 or 44 and younger. And then you see the breakdown by race and ethnicity, the cases. Next, you can see the hospitalizations, and this is much better than we were several months ago. We're hovering around between 45 and 55 to 60 cases, so we are very fortunate that that number is staying relatively stable for Forsyth County residents who are hospitalized in Forsyth County hospitals. Next, you can see the demographic that shows our deaths overall. 1.1% of COVID cases result in deaths. You can see the breakdown by gender, and you can see the breakdown by age, with the overwhelming majority are persons that are 65 years of age or older. Then you can see the breakdown by race, total numbers, and then the case fatality rate or percentage of individuals by race that with COVID that result in death. This is just another metric that this shows over time. This is in mid-October, we were at 111 deaths, and now we're at 317. So you can just see the progression over the past 4 months as the deaths have really just steadily. We haven't seen any big spikes. It's just over time we're seeing more deaths, just a cumulative effect. So next, vaccine. Obviously, that is the biggest focus from the Department of Public Health over the last 2 months, since December 22nd, when we got our first doses of COVID vaccine. So far, the health department has administered 29,023 doses of vaccine. That's as of February 16th. We're still working through our numbers. I believe it was yesterday, we cracked 30,000. You can see the residents we've served. We've served residents from 69 counties, which is 7,252 of our doses have come from individuals across the state, and 123 doses from people outside of the state, 18 other states. Forsyth County residents received just under 75% of the vaccines that we dispensed. So 21,648 of the doses that we've given at the Department of Public Health have been to Forsyth County residents. Next, you can see that number I just shared with you. Obviously, Forsyth County, that's where we've given most of our doses to Forsyth County residents, 75%. But then you can see the top 4 other counties, with Guilford with 3,419, just over 1,100 individuals from Davison County, then Stokes and Davie County residents. This next chart shows Forsyth County residents who've received a COVID-19 vaccine. And this is data from the state's dashboard. And this is any Forsyth County resident, and they could have received the vaccine anywhere. So far, 45,247 Forsyth County residents, which is 11.8% of the population in Forsyth County, have received their first dose. And then you can see on the left-hand chart, the breakdown by age. You can see that the majority are in 65 to 74 years of age, and then the next is 75 years of age and over, and then that 25 to 49-year-olds so far has been our healthcare workers and long-term care staff. Then when you look on the other side of the slide, you can see that the 26,983 residents, or 7.1% of the Forsyth County population, have received their second dose. And again, it sort of follows the same breakdown with our older population, 65 to 74 and 75 plus, receiving the lion's share between those two groups. But then you also have the 25 to 49-year-olds, which has been our healthcare workers so far. Next is the same dashboard from the state for Forsyth County residents who could have got the vaccine anywhere in Forsyth County or went to another county, but they're all residents. And this has it broken down by race. For dose 1, you can see the breakdown with primarily the 76.8% white, 16.3% African American. Then you have 3.3 Asian, then other, and then you see the way they have Hispanic broken out separately, which is roughly 3% Hispanic. Then you can go to the next slide, and it has dose 2 broken down by race, which is roughly the same breakdown. So some outreach events that we're doing just to our historically marginalized populations, just highlight some ones that we've had. Last week on 2/19, we were at Holland Homes. 17 doses were administered. And then on the Saturday, Shiloh Baptist Church, 168 doses were administered. And this was a Shiloh Baptist Church working with other churches in the area to do this outreach. Really appreciate the work of our new clinic director, Edwin Marshall, and his team, and Ms. Robinson, putting together this, working with Senator Lowe to make that happen. And then the other event on the 21st was also coming back through Holland Homes to their second location, and 37 doses were administered there. And we're continuing to do this targeted outreach out into the community, also working with Novant and Baptist Hospital to coordinate and make sure we're working in tandem and collaborating together to reach our population. We're also working with Map Forsyth to get this information about the vaccine distribution in the community by zip code, so we'll be able to see where we need to go and where we haven't gotten good penetration by zip code to help us be more targeted and strategic in our approach. Just some more information. You've seen this before. And as of now, the 23rd, we're still in groups 1 and 2, healthcare workers, long-term care center residents and staff, plus older adults. The 24th, you'll see we start that sort of the runway for faculty and staff at public and private schools, as well as child care providers who are eligible to receive the vaccine, regardless of age. And then March 11th, we'll open up to all frontline essential workers in Group 3. So that's just a little bit of information. Just some more some notes I had. This Saturday, we'll be vaccinating from Winston-Salem Forsyth County Schools, approximately 1,500 faculty and staff that are part of that Group 3. We'll be able to do that. And as far as vaccine shipments that continue to occur, there was some weather delays last week. This week, so that backed up some of our shipments. So far this week, we've received 700 doses of Moderna and 2,850 doses of Pfizer. So we are hopeful as these groups open up and more people are eligible for the vaccine that we'll continue to get more vaccine to us because with the fairgrounds, we have the capacity to do 8, 10, probably even more, 8, 10, 12,000 people per week. The first week we were there, we did 8,000 doses. And last week, we did 3,500 doses. So due to the shipments being less and less. So we're hopeful that this is a positive trend that we're going to start seeing more vaccine in the community. We're seeing more providers that are coming on board, such as Walgreens pharmacies. But again, their shipments are usually 100 doses per pharmacy. And we have a setup that we feel we can reach a large amount in the population at the fairgrounds and also doing target outreach. So that's the end of my slides, and I'll be happy to take any questions.
Questions?
And if I could say,
yes.
And if I could say one other thing real quick, and I do appreciate your comments, Mr. Plyler, but obviously it's a huge team that's working on this in public health, and other departments are helping out. We appreciate their help because it takes a team of roughly 100 or more people with volunteers and staff to put this together.
I noticed you got a break today. You don't have to wear your vest and everything. You've actually got a necktie on.
Yeah.
Any questions or comments for Mr. Swift?
Just 2 quick questions, please, Mr.
Yes,
Chairman.
sir. Mm-hmm.
Thank you again, Mr. Swift, for a very detailed report. I was in conversation with some commissioners from Bladen County, and they were reporting that in that county, 63% of the people who were dying were African Americans. And I want to know if you'd heard anything like that, been an outlier statistic, or what has been your information source in terms of those counties on the East Coast of North Carolina? And the follow-up is, all of us on the county commission have had both of our shots, so we're 95% plus protected. Could we move back to our original chairs?
Well, I don't know how to answer that second question, Commissioner Elamine. But I will say, having worked in southeastern North Carolina for 6 years in New Hanover County, I know that Bladen County and some of those outlying counties, Pender, Duplin, Sampson, some major health disparities there. But we have been. So I can't speak. I haven't worked specifically in Bladen County, but it is, we had health disparities. We knew that before the pandemic, and unfortunately, COVID-19 has focused a lot on those that are still there. So,
Mr. Chairman, I have one question.
Yes, sir. Go right ahead.
Joshua, thank you for the report, and certainly all the people who are working out at the fairgrounds to vaccinate folks, everything from volunteers to professionals to National Guard, you name it. But the question I have is, you indicated in all those statistics, I'm just pulling out one, and that being that 11 point something percent of Forsyth County residents of total residents have been vaccinated. When we see the breakdown by race and gender, we're just seeing a percent of the total of those vaccinations administered. And I'm kind of curious, which gets partly back to Commissioner Elamine's question. This is not about deaths, but it's about the disparity in the actual vaccinations. Is what percent of the total white population in Forsyth County has been vaccinated? Same thing for our other racial and ethnic groups. Because I like that kind of help, and it would be great if we could see that sort of progressing each see what kind of change we're making each week, each report. If we're at 11.1% this week, hopefully we'll be 12.5%, 13%, and hopefully those will begin to grow, faster. But likewise, we're just seeing the percent of the doses administered, not the percent of that population being vaccinated.
yeah, that is an excellent point, Dr. Martin, and I was trying to pull that up, but I won't. I'll bring that this Thursday since we're meeting again later this week, and I can bring that information to you. Just looking off what I've just pulled up in the last 30 seconds, it looks like our African American population, the percent of the population that's received the first dose is 7%. For African Americans, 13.6 for white, 2.8 for Hispanic. But I'll get that in finer details and have the most up-to-date information this week, this Thursday.
Joshua Swift, thank you very
Joshua?
much. Yes, Tanya?
That's okay. I was
Tanya
waiting for
McDaniel
her
has a
to
question
finish.
for you.
Joshua, I just wanted to say thank you so very much. First, I have to say thank you to the volunteers in this community. I continue to say that if our communities are to be, it's up to you and me. And so although we may sit here as commissioners, we need our communities to kind of step up and help through this pandemic. I wanted to say thank you to Edwin Marshall and Chantel Robinson for continuing to listen to our communities. We need to continue working to build trust, and we're doing that by ways of working with the churches. I know that we're working with our Hispanic communities and the NAACP. So seeing these vaccination outreach opportunities for Holland Homes and other various ones that will be matriculating in the next couple of weeks. I wanted to just sincerely say thank you. We definitely need to continue to put our feet to the pedal and continue to keep the work going. But I see the work that you're doing. I wanted to acknowledge that and also let the community know that there is a place and a space for you to help us through this pandemic. And thank you so very much. And the last thing that I would like, Joshua, if you could leave a telephone number. I have a few group of constituents that aren't able to connect with the computer to get online. So if there's a telephone number that you could share where they can call for the vaccinations, that would be greatly appreciated. Thank you.
All right, thank you. And I will get that number I don't have that off the top of my head. I'll get that. I can put it in the chat function. And I think maybe Ashley, if that could be shared, I'll definitely do that.
Thank you very much.
Additional questions or comments? Thank you, Mr. Swift. Appreciate your report and all your work. Thank you so much. The next item on the agenda is approval of minutes for the meeting of February 4th, 2021.
So moved.
We have a motion, a motion by Commissioner Martin, 2 seconds by Commissioner Ted Kaplan and Commissioner Fleming Elamine. Any further discussion? If not, do I hear yes or no in favor of or against? All in favor of?
Yes.
Yes.
Aye.
Opposed? Unanimous. Next item on the agenda is the public session. And now it's time for the clerk to the Forsyth County Board of Commissioners, Ashley Sloop, to take the stage and tell us the answer to the question, do we have anyone who wants to talk during the public session?
We do, Mr. Chairman. We have one caller.
Go right ahead.
Thank you for calling the Forsyth County Board of Commissioners Public Session Line. This session is for comments only, and questions cannot be answered. Please state your name and address for the record.
Dietrich Williams, Cardinal Innovation.
What is your address, sir?
550 South Caldwell Street, Charlotte, North Carolina.
Thank you. Speakers will be limited to 3 minutes, and a 30-second warning will be given. You may begin.
Thank you. Good afternoon. My comments this afternoon are related to a county government matter, specifically the disengagement of Forsyth County from Cardinal Innovations. As it relates to progress, a few weeks ago, Karen Bentley had the privilege of presenting the status of Cardinal's plan of action, where she highlighted a few areas where progress is being made, programs being implemented, and some other improvement efforts. Last week, the Deputy County Manager said in her presentation that it was too early to tell about the progress. While progress has been made, and we disagree that it's too early to tell, but we also continue to meet with the leadership and work through even more ways we can continue meeting the needs of Forsyth County residents. Much of the discourse has centered around children involved with the foster care system, as well as the adult wards with DSS. However, the program to manage children in foster care is moving to a statewide foster care plan targeted for July 2022, which incidentally could coincide with the timing of any transition from Cardinal to another LME MCO. Despite this, Cardinal Innovations has developed a child welfare program, and this program really includes evidence-based practices and a model of care that has been proven to work in other states to manage this population, with elements such as early intervention with children who enter the system, where we provide community-based services and support to foster families, a co-location model that aligns managed care staff with local DSS offices, an evidence-based model of care that has the goal of reducing congregate care and really focuses on community-based services and permanency. We have also entered into a program worth about $3 million that over the next 2 years can help Forsyth County address the needs of foster care needs and serve as a bridge until the department implements the statewide managed care program. At this time, the county has not agreed to participate in that program. But beyond the needs of the foster children in Forsyth County, we've also implemented targeted efforts to serve the population in Forsyth, including overutilization of your EDs, provide access to peer support professionals, and really ensure that individuals with intellectual disabilities receive the services they need. Every single item detailed in the letter to DHHS has been addressed in a meaningful fashion. And each time we report progress, the targets and goals continue to move, but we continue working with the county to achieve the results required for the residents. And while these actions will improve our services for these important fragile members, I ask that you remember we serve nearly 60,000 citizens in Forsyth County. We continue to invest heavily in Forsyth County with $160,000 in COVID relief funds going to nonprofits, providing education and support to community organizations.
Sir, your time
Our
is up.
commitment to the community is strong, and we continue to provide support to Forsyth County. Thank you for your time.
Thank you very much, sir, and thank you, Ashley Sloop, for helping us on that. Commissioners, I may just mention, because I think we've all had contacts from someone in the Cardinal organization regarding the resolution, and by the way, in our discussions today for the briefing on March 4th, we will have as item number 11, a discussion of the resolution regarding the disengagement of Forsyth County from the Cardinal organization. And by the way, Trey Sutton, who is the chairman of their board, has called me on numerous occasions wanting to know if we voted yet. And I said, no, we have not. But he said, just give us a chance, a little more of a chance. I just mentioned that because I have heard that. And I want to pass all the information I get on this matter along to everybody. Mr. Manager, it's time to finish the remainder of the agenda.
Thank you, Mr. Chairman. Good afternoon, board members and staff and guests. We do have a fairly brief agenda for today. We did remove the items related to the bond issuance just because of the publication guidelines that we had. So I'll go ahead and dive into the agenda. Item 3 is a resolution authorizing submission of an application to the North Carolina Housing Finance Agency to apply for, and if accepted, and if awarded, the 2021 Urgent Repair Program funding. It is $100,000, and the goal is with this to serve 14 families in our Department of Community and Economic Development.
Questions or comments?
Move to approve.
Motion to approve by Commissioner Fleming Elamine.
Second.
Second by Commissioners McDaniel and Commissioner Martin. All in favor of the motion, say aye. Aye. Opposed? Motion carries unanimously.
Agenda item 4 is an amendment to the 2019 Housing Grants Project Ordinance. It appropriates additional home program income in the amount of $175,000, and we can use this program income for any of the allowable grant expense.
Questions or comments? A cough by Commissioner McDaniel. Do I hear a motion?
Move to approve.
Motion to approve by Commissioner Fleming Elamine, second by Commissioner Don Martin. All in favor, say aye. Aye. Opposed? Motion carries unanimously.
Agenda item 5 is a resolution authorizing execution of an amendment between Forsyth County and IntelliChoice Staffing, LLC. It provides additional temporary staffing employment services for the COVID-19 vaccination response at the Department of Public Health. The amount is not to exceed we'll take the total contract amount not to exceed $423,500.
Questions or comments?
Move to approve.
Motion to approve by Commissioner Whizenhunt, second by Commissioner, which made the second? Was that you, Commissioner Martin? Fleming Elamine, okay. Fleming Elamine made the second. All in favor, say aye. Aye. Opposed? Motion carries.
Agenda item 6 is a resolution authorizing the execution of an agreement to purchase real property subject to the due diligence examination and other conditions, and authorizing execution of all necessary agreements to make a diligent examination of the property. The property is located at CG Hill. It's 12 acres with a home on Balsam Road with a leaseback provision, and it is a key piece of property with respect to the expansion and even kind of the continued operations of CG Hill Park.
Questions or comments?
Approval.
Motion to approve by Commissioner Whizenhunt, second by Commissioner Martin. All in favor, say aye. Aye. Opposed? Motion carries.
All right. Agenda item 7 has a number of parts, but they are all extensions of ambulance franchise agreements, and so I'm not going to read each one of them, but there is one for the non-emergency ground ambulance for New Care, also for Lifestar. You've got the ground ambulance franchise to Forsyth Memorial Hospital, the one to North Carolina Baptist Hospital, the extension of the limited air ambulance franchise to Forsyth Memorial Hospital, and then also the limited air ambulance franchise to Baptist Hospital. And all of these franchises really are important components of the medical response system here in the county. We rely on them extensively.
Questions or comments? Motion to approve by Commissioner
Mr.
Ted
Chairman,
Kaplan.
I'm sorry to interrupt.
Yes.
This requires a second reading.
Oh,
The ordinances do. So what we'll do is move this to the March 4th meeting to be voted on.
Okay, thank you very much.
We still vote.
I'm sorry?
We vote twice on it, so we.
So
still
we will vote
today.
on this, okay? So we have a motion, was that Commissioner Fleming Elamine? Ted Kaplan did it, you seconded it.
I'll second it, yes.
Okay. All in favor of the motion on this first reading, say aye. Aye. Opposed, motion carries. Got it, thank you.
Agenda item H, a resolution approving the release of taxes by the tax assessor collector in the amount of $80,455.38. It is with the Enclave 2 development, which is a low-income housing development, and they applied for those.
Questions or comments? Motion to approve by Commissioner Ted Kaplan,
Second.
second by Commissioner Fleming Elamine. All in favor, say aye. Aye. Opposed, motion carries. By the way, Commissioner Kaplan wanted to approve the entire agenda without doing any conversation earlier today, and we didn't do that, so, Mr. Manager.
All righty. And the ninth item is an added item. It is a resolution to establish a community early childhood education task force. Really has lots of involvement here, but basically to take a look at the pre-K system in a real organized and kind of open format.
Comments, questions?
Approve.
Motion to approve by Commissioner Martin. Question by Commissioner Ted Kaplan is what?
No cost.
No cost, okay. Additional questions? We have a second on this motion?
Second.
Second by Commissioner Fleming Elamine. All in favor, say aye.
Aye.
Opposed, motion carries unanimously.
Point of privilege, Mr. Chairman.
Yes, sir.
After consulting with some more educated people than myself about this matter, they wanted to remind me that we should focus in on reading in this regard and make that the literary focus for this program called Pre-K, for the record.
Good, thank you very much, sir. Mr. Manager,
That's it.
is it? Do you have any further comments before we adjourn and then go to the briefing?
Chairman, yes.
Yes, ma'am, go right
We
ahead.
would like to celebrate our colleague today, Commissioner Fleming Elamine, on his born day.
Is he 40 already?
I don't know about 40.
Do you want to sing happy birthday, Miss, and lead the song?
I just said happy
Oh,
birthday.
you just did. Happy birthday, Commissioner Elamine. Well, if there's no further business to go before this official meeting, I almost said Senator Ted Kaplan, I'm sorry, Commissioner Ted Kaplan wants to adjourn this meeting before we do the briefing session. I'll second the motion. All in favor, say aye.
Aye.
Opposed? We're adjourned. We'll take about 3 or 4 minutes and then come back for our briefing.